I strongly believe the cure is in sight. The reason why I say that is because even we look at some of the studies that were done even like 10, 15, 20 years ago, there's always been a 10 or 15% of patients who live 10, 15, 20 years from their diagnosis. So there's a small fraction that's already been cured. Our goal is to make that fraction bigger and predictable. And how can we get there? I think it has to be a two-pronged approach. One is obviously we need to have effective tools, and we are getting them, and to use them in combination so that we can get the whole spread of the different clones of tumor that's sitting there, and to do that early on before there are too many clones of cells sitting there. So the approach now is, can we actually do the treatment early? So we have a perfect example in myeloma where we know that there is a phase before the patients actually get symptoms, which is called the smoldering myeloma. So what we are really trying to explore now is, can we actually treat patients with smoldering myeloma with very aggressive combinations which are highly effective and potentially cure some of these patients. So there are clinical trials being designed. There's a trial in Spain that's called CESAR trial that is looking at a combination of carfilzomib, lenalidomide, dexamethasone and transplant. So there's a trial that is going to be starting up in the United States called the ASCEND trial that is going to be looking at a combination of carfilzomib, lenalidomide, dexamethasone and daratumumab with or without transplant in about 80-90 patients to see if we can actually cure these people. So I think the day that we are going to see some of these patients being cured is closer. Obviously the task ahead of us would be to be able to predict who is going to get cured and what approach is going to help them get cured, and for the people who are not getting cured, what else can we do?